Sometimes families feel concerned about their child's development, but let time go by because they're afraid, nervous, or overwhelmed by information. Maybe it feels uncomfortable to think about your child being labeled, or it's not easy to figure out how to look for help. We want to talk to you briefly about medical diagnosis, why it can be a very important part of your child's development, and what getting a diagnosis looks like. Our mission at Arkansas Support Network is to recognize and support every person's right to be included in the life of the community. Working together to discover a person's strengths and needs is an important step in understanding how to support people with disabilities to have good friends and family relationships, do meaningful work, and enjoy their lives. Identifying and understanding an underlying diagnosis can be part of creating home and community support systems that work. Most of us are familiar in some way with the process of getting a medical diagnosis. When we notice a physical or emotional symptom or change that we can't explain, but that's impacting some aspect of our lives, we often begin to look for answers. If we go to the clinic, the doctor listens to our description of the symptoms and does an examination or other test, and makes recommendations about what treatments or interventions may help. When parents and caregivers observe that a child is having difficulty learning to walk or talk, coordinate their hand movements, or play with toys, the same type of process can be used to see what may be causing the delays and what support might be needed. If you have concerns about your child's development, it's important to learn how to tell if they're developing differently from typical children their age. You can find information about when children typically reach their developmental milestones at the Centers for Disease Control and Prevention, or CDC, website. Families are so busy balancing home life, children, work and school, and everything in between. It can be very helpful to keep a record or journal describing the aspects of your child's daily behavior and activities that concern you so that you can remember them later. This information will be important if you decide you'd like to seek medical help. Schools don't diagnose conditions. Only doctors and other clinicians do. Some children may have learning and thinking differences that cause difficulty with reading, writing, math, or social skills in school. They may have behaviors that impact their learning and relationships with teachers and classmates. The school's responsibility is to identify those differences and make a plan for how to help the student to get a free and appropriate education. A medical diagnosis by a doctor or specialist can provide the school with additional understanding that may help to choose the best strategies for their individual needs. A medical diagnosis can be useful for several reasons. It provides information to help families look for the right care and support. It gives doctors and therapists information that can guide them to develop treatment plans and use methods that can more directly address the child's needs. It also helps families, teachers, and caregivers have a better understanding of how to support children at home, at school, and in the community. Being informed about what a child needs and why can help to encourage patience and support fair treatment and understanding, especially in preschool and public school settings. A medical diagnosis can open the door to benefits, services, and supports so that families can get more of what their child needs. State health insurance plans like Medicaid and TEFRA require documentation of a diagnosis, for example. Medicaid programs, including Our Kids, SSI Medicaid, and TEFRA, cover many of the durable medical supplies children with disabilities may need, including diapers, supplies for nutrition, wheelchairs, walkers, standers, bath chairs, or other equipment. Medicaid also provides some funding for transportation for non-emergency medical appointments. To receive Supplemental Security Income or SSI benefits, the Social Security Administration requests documentation of medical diagnoses. Also, occupational, physical, speech, developmental, and applied behavior analysis therapies may be recommended based on a diagnosis. A medical diagnosis can also provide important information for the school if it looks like an educational evaluation is needed. If you decide it's time to look for help, make an appointment with your family doctor or pediatrician. This is your time to let the doctor know what behaviors, difficulties, or symptoms you've observed as you watch your child from day to day. You can use your notes or journal to help you remember what information you want to share. Your doctor will do an examination as well as any needed referrals to other medical professionals. This way, the doctor can make sure that physical or mental health conditions that may be affecting your child's well-being will be diagnosed or ruled out. You can see here a short list of the kinds of specialists that might be needed to help you understand your child's needs. A pediatric neuropsychologist may specialize, for example, in administering an evaluation to diagnose or rule out an autism spectrum disorder. Effective physicians observe, listen, and examine. If an evaluation or assessment is needed that's not in their area of expertise, doctors will make a referral to another medical professional. Some examples could be a possible seizure disorder would likely cause the doctor to make a referral to a neurologist. Or if the doctor suspects that a child is on the autism spectrum, they may refer to a neuropsychologist or other qualified person to do an evaluation. It's not always easy to think of questions at the moment you're with your doctor. To prepare ahead of time, write down the concerns and questions you have before going to the appointment. The medical visit may leave you feeling either overwhelmed with information or without enough information to feel that you understand clearly. Always ask the doctor any questions that you have on your mind to make sure that you understand what is being recommended and what you need to do next. That way you can be sure that you don't arrive home with doubts or concerns that the doctor could help to address during the appointment. Parents and families are the experts when it comes to their children, and you are your child's best advocate. If your doctor doesn't think there's a problem or says that your child will outgrow it, but you still have concerns, you have the right to get a second opinion. It can help your search for another physician if you talk with other families, teachers, or community professionals in your area. If you have doubts, it's better to listen to your instincts and try to look for the help you feel your child needs. It will be important to talk with your child's insurance provider to make sure you understand how coverage may or not be provided for a second opinion. This will help you to make informed decisions as you go. If the doctor decides to make a referral to a specialist, it's good to make sure you have all the referral information before you leave the clinic if possible. This information can include the name of the specialist or clinic your child is being referred to, along with the address and phone number, the specific reason the doctor is referring your child to this specialist, who will make the appointment with the specialist, you or the doctor, and is there any paperwork that you'll need to fill out. Also, how long you should wait to hear from the specialist or clinic before you call to check on the referral appointment. It's important to go ahead and call if a clinic does not contact you when the doctor said they would. The communication between your doctor's clinic and other medical clinics and facilities can be complicated. It's best to always assume that you'll need to call the specialist or clinic's contact number to confirm that the referral has gone through and to see if there's anything else you need to do before the scheduled appointment. If transportation arrangements are a challenge for your family, make sure you've arranged ahead of time for a way to get to the clinic. Don't forget to make a list of the concerns and questions you have before going to the clinic. If you're not into pen and paper, you might try dictating your questions into the Notes app on your phone, or send yourself an email or text that you can open during the appointment. Be sure to let the doctor know that you're looking at your phone to remember the questions you want to ask. To make a diagnosis, a medical specialist completes tests or assessments in their specialty area that can help to diagnose the condition. Often the specialist asks the family for their observations or other information that can help to put together a picture of the symptoms or behaviors your child is experiencing. A psychologist or therapist may compare the child's development to other children their age, conduct interviews with parents, and sometimes ask families and teachers to fill out questionnaires. The medical specialist, psychologist, or therapist will usually be able to talk about their impressions, conclusions, a possible treatment plan, and any further referrals at the end of the appointment. Some form of written report is usually completed after the evaluation with information about the results, diagnosis, and recommendations. Having something in writing is especially important if there are medical or other terms that you're not familiar with and will want to research later on. A report should be signed by the specialist and show their credentials by their name. We've talked about what a diagnosis is, the process that's involved, some of the doors to supports and services that getting a diagnosis can open, and some tips for communicating with the medical professionals who provide this valuable service. Going through the process of getting a diagnosis can be an important tool to help you find the services and supports your child needs to grow and thrive. Remember, you're not alone. If you feel overwhelmed, there are resources, information, and support to help guide you. At Arkansas Support Network, the Division for Children and Families offers resources and information, applied behavior analysis, or ABA therapy, for children and youth with autism up to age 21, and care and training homes for children with disabilities. Our Family Support Program serves families with children who have disabilities up to the age of 26 and older and provides information and training about special education services and community resources. Our services are free of charge. If you'd like more information about this and other topics, you can find information at these links online. We appreciate the time you spent with us during this presentation and hope that the information we presented has been helpful to you. If you would like to contact us, please call the Family Support Program of Arkansas Support Network at 479-927-3283 or send us an email. Thank you.